So,
Hold on, is that thing on? Can I just check to see if it's on?
testing.
Just a light on.
Alright.
Lucy.
I ask myself that same question every day when I come up here and I look at you and I'm like, is the light on?
You're so funny.
Right over the list. All right. So there's a lot of things in a person who that will affect their nutrition that we all need to be aware of. Okay. Developmental age or developmental stage. We talked a little bit about how infants need more what?
Fat.
More fat. What about older people? More protein, less fat. Okay, because what happens when they get too much fat, their arteries get all clogged up. Okay. Educational level is a big thing too. Some people don't realize that, again, there's serving sizes. Okay? They don't realize why eating at McDonald's 3 times a day is bad for them. It tastes good, right? We all want food that tastes good. But is it healthy for them? Okay? And group 1, we found out yesterday, there's a lot of unhealthy fast food out there. I mean, it's only gotten worse. Okay? Lifestyle choices. Caffeine. What does that do to the body?
Adrenal glands.
It stimulates your nervous system. That's why if you drink too much, you get these. The shakes. Okay? It can cause damage to the lining of your stomach. All right? Ever heard of a duodenal ulcer? It's different for everybody. Your tolerance. Okay. Nicotine is one thing as well. What does nicotine do to the body? Do you know?
Ruins the lungs.
It does ruin the lungs. It's a vasoconstrictor. So if somebody's already hypertensive because they have high cholesterol and they smoke, which is going to cause all those vessels to get smaller, what's going to happen to their blood pressure? It's going to go up. Okay? And put them at risk of developing what? Heart disease. Coronary artery disease. All right? Ethnic, cultural, and religious practices. We went over those a little bit last week, right? When it comes to practices amongst Mormons, it's typically frowned upon for what? Caffeine, or hot caffeine, alcohol, okay? What about Islamic or Muslim patients?
Pork.
Pork is a no-go, okay? And yes, bacon, unfortunately, is pork. Unless it's turkey bacon. Then it's not the same. All right? Certain disease processes and functional limitations. If somebody has a hard time reaching above their head, are they necessarily going to be able to get any food products out of the cupboard? Okay? Or what if somebody is in a wheelchair? They can't get up there to get the food without typically what? Some type of grabber. Okay? Or, in the last few years, I've noticed at Home Depot, they have those things that can pull down and bring the shelf down to that level if necessary. Okay. Or what if somebody is only 3 feet tall? What if they're a dwarf? Or a little person, excuse me. Okay. All of their facilities are going to have to be modified to fit them. Okay. Medications. Now, we talked about diuretics, which typically make you do what? Make your patients pee. Okay. Tries to get rid of any excess fluid the body has. Okay. But then we have laxatives. What's that going to do? It's going to make you poop. Can you abuse either one of those?
Yes.
Yes, you can. Hollywood is infamous for having their actors abuse diuretics to make them look leaner, believe it or not. Okay. Laxatives can be abused by anorexic people because they will take a bunch of the laxative and then they'll go out with friends so that nobody assumes that they're not eating. They'll eat a whole bunch, but then it goes right through their body because they've taken that laxative to get it to go through, so their body's not even able to absorb anything. Okay? And then knowledge of nutrition, concepts of access. We have, I don't know if you guys are aware, but we have a food closet here for student use. Were you aware of that?
Yes.
A what?
We have a food closet here on the 3rd floor for student use. So if you need vegetables or something to eat, whether it's for lunch or to take home to feed your family, you can go in there and get a couple things, and at least that way we know that you're eating. I didn't know that you guys didn't know that, but yes, we have a food pantry here basically, okay? And for those of you who might feel a little bit more blessed in that arena, if you have extra food that you are not or don't anticipate eating soon, bring it in and drop it off, okay? All right. Alterations in nutrition. Unfortunately, what's the #1 problem here in the United States? Overweight or obesity, okay? Obesity is considered anything above a BMI of 25, okay? As far as body mass index is concerned. Now, earlier we talked about BMI is the most accurate, right?
No, you said it was not.
Exactly. It is not accurate because somebody like Mason, if they are tall and built and they weigh, 275 pounds and it's all muscle, according to the BMI, they are going to be severely overweight or morbidly obese, okay? So it does not take into account density of the tissues, just the weight and the height, all right? Consuming nutrients in excess of metabolic needs, we should just be, eating the right amount of calories, like how many we are burning. So the whole purpose of exercising is to create that deficit and that difference, so that way you're burning more calories than you're consuming, okay? It's one reason why you cannot lose weight by just not eating enough. That's what my doctor keeps telling me, but I have been. All right. For patients that are overweight, I hate using the term obese, but overweight, we need to make sure that they're aware of their caloric intake and how to calculate that, okay? Versus what their overall caloric need is. Encourage exercise and lifestyle changes. Me, personally, I am not a big person when it comes to being sweaty. I hated gym in high school. I don't mind going to the gym. I hate going by myself. Because I'm like, I want somebody to talk to or something, please. Make it social. But anywhere between 15 to 20 minutes a day, or 30 minutes 5 times a week. You are looking for about 150 minutes, almost at hours, of moderate exercise a week. Okay. Weigh weekly. Suggest a food diary. What's a food diary? Keeping track of what you've eaten. Correct. Okay. Sometimes you can even get away with a 24-hour food recall. But how many of you guys remember what you had for breakfast yesterday morning? 3 people out of 30. Like, I barely what I remember I had for lunch today, okay? All right. Then we have the opposite end of the spectrum, underweight, okay? Now, can someone who weighs 400 pounds be malnourished?
Yes.
Very easily, okay? If they're having Cocoa Puffs for breakfast, lunch, dinner, bedtime snack, afternoon snack, onesies, elevensies, whatever, okay? For my Hobbit fans out there. They're not getting the nutrients that they need. Okay, so yes, they can be malnourished, all right? Same thing here. People can take, limit types of foods. They will not eat anything that has any type of fat in it, or eat anything at all. Or they could just not have an appetite anymore, okay, depending on their disease process. Cancer patients are notorious, especially when they are currently on chemo. They lose their sense of appetite because the chemo, they're continuously nauseous. That's why marijuana came into play, or THC I should say, with cancer patients. Because what happens when you toke up?
Munchies.
You get the munchies. It's an appetite stimulant for cancer patients. Sometimes too though, it can help increase the effect, if not the efficiency, the efficacy, that's the word, of any type of pain medication or anything that they're taking, because of their cancer. All right. Now we want to make sure that we are encouraging them to maybe rule out an eating disorder if that's the case. Okay. Encourage strategies to improve their appetite. You know, if they need appetite enhancers, or if they want, you know, especially with hospice patients that are at the end of their life cycle, or what they call transitioning from this life to either the next or the afterlife, whatever. Typically hospice facilities, they will have kitchen staff there 24/7. And if somebody wakes up, or you know, it's 3 o'clock in the morning and they just want blueberry pancakes at 3 o'clock in the morning, they get blueberry pancakes at 3 o'clock in the morning. Because you want that, you're hungry, we'll get it for you. Okay? That's one of the most awesome things about hospice to begin with. Okay? Enteral nutrition. Now last week we learned to put what where? Nasogastric tubes or NG tubes down. Okay? So enteral nutrition. Sometimes you might have to feed patients that way in this aspect. Okay? Sometimes, generally in the hospital, it's not by force. If you were eating in like a behavioral health clinic dealing with anorexic patients and things, that might be the case, that you have to physically hold them down, put an NG tube down, give them the nutrients, and then take the tube back out. Okay. But that's more behavioral. You guys will get to that, I think, next semester in your mental health course. Okay. We're gonna get a sense of what their appetite is. So tell, you know, what do you eat on a daily basis? Because that's gonna tell us, you know, how much they're intaking, what it is. Okay. If they're drinking a 12-pack of Pepsi every day, and they cannot figure out why their blood sugars are high, you laugh, but there's patients out there. They don't correlate it. Okay? So, elimination patterns. How long the food sits in the body matters. Okay? If a stool sits in there too long, it can become hard and dry and very difficult to pass, which can cause other issues. All right? So, we want to make sure that they're eating enough of the proper foods. So, what are some foods that would help with elimination? Fiber, spinach, greens, kale. Yeah, that's the
Quinoa.
What was it?
Quinoa.
Quinoa, brown rice, all those good. What does all that have in common though too? Complex carbs, fiber. Okay, better for you. Activity levels. If you're laying in bed all day, you're going to be at a higher risk of becoming constipated, which leads into that elimination pattern. But if your activity level is not up enough and you're not causing that use of the calories that you're taking, you know, it's going to diminish your appetite as well. Nutritional screening tools. There's one coming up here in just a second. We want to know how many meals a day that they are taking in. Okay. Sometimes people only eat twice a day, breakfast and dinner. Lots of times people skip lunch, which is not good for you. Sometimes people skip breakfast and they'll eat lunch and dinner. There's a thing going around, at least that I've heard of in the last few months, called intermittent fasting. Have you guys heard of this?
Oh yes, I love that.
I'll talk to you about it then. Because I'm kind of interested, but I'm like, what are the ramifications? Okay? Trying to get, this has gotten a lot less, but there's still more to go. We want to make sure that they're getting enough fluids. Now, you can drink 10 cups of coffee, iced tea, but if you're not drinking enough water, you will become dehydrated. Okay? And not just, you know, overall, but at the cellular level. Things can leak out into the plasma of the blood, like potassium, like we found out on that video, if you don't have enough fluid. That's gonna cause your potassium level to go through the roof, which will then possibly can stop your heart. Potassium is one of those electrolytes that if it's too high or too low, your heart can stop. Okay. History of indigestion, allergies. I don't know why, but in the last like 10, 15 years, it's like everybody's allergic to peanuts. Peanut butter, peanuts, nuts in general. I don't know why that is, but we need to be aware of any food allergies people have. Sometimes people are allergic to strawberries, berries in general, so be aware of that. Their level of taste. Remember when we were doing hygiene, why is it important to make sure you do oral hygiene on your patients? It can affect their taste. Because if their tongue is not clean, it's got all this dry gunk on it, or just, you know, they haven't been able to rinse their mouth out or anything, it's gonna affect their taste, which in turn is going to affect their appetite, okay? And then chewing and swallowing ability. If somebody doesn't have teeth, they don't have their dentures in, let's say, okay? And you give them a hamburger, is that gonna be something that they're gonna try to eat? Hopefully not. If they're confused, they might, okay? But they shouldn't, all right? Or a big old chicken sandwich with a big old chicken breast on it, right? Are they gonna be able to chew it? No, so that's gonna be an issue, okay? Wanna make sure they have their teeth in. We talked about this already. A mini nutritional assessment. Now, I will say, this is one that was put out by Nestle. Everyone's familiar with Nestle, right? Nestle's chocolate, Nesquik, all those fun things. Nestle is actually one of the leading producers of tube feeds that we use in the hospitals. All the different formulations.
Wow, that's funny.
Mm-hmm. Well, I know they used to, I think they still do. They make a product called Instant Breakfast. Have you guys ever seen that? Carnation Instant Breakfast. It's basically like, I think it's chocolate or vanilla flavored powder that you add to milk and mix it, and it has all of the nutrients in it. It's basically tube feed, but you just drink it. Same thing with Ensure. Ensure is a protein supplement. It's a drink. I used to have to drink it when I was a kid because I was underweight. Now look at me. But, so a mini nutritional assessment is going to talk with, it's a form that we would utilize to see what their risk factors are as far as malnutrition, not male nutrition. Okay, so the first question here, has food intake declined over the last 3 months due to loss of appetite, digestive problems, chewing or swallowing difficulty? Okay, the higher that the person scores, the less likely that they're going to have malnutrition. Okay, so obviously no decrease in food intake. Weight loss during the last 3 months. And it gives examples here. So weight loss greater than 3 kilograms, does not know. Weight loss between 1 and 3, or no weight loss. Mobility, has suffered psychological stress or acute disease in the past 3 months. Neurophysiological problems, so dementia or depression. Mild dementia or no problems, and then their BMI, okay? And then their calf circumference. So yeah, we would measure their calf to see if they've lost any muscle tissue, okay? Because then that tells us what? Their body's breaking down the protein in the muscle, so they have not been eating well enough, okay?
The F1 that you have right there,
Uh-huh.
it's measuring BMI and it's using it to scale the assessment, even though you can have
false positives with it, yeah. But like I said, it's a guideline. It's not a hard, fast rule. So the majority of the public it does kind of fit for, but again, there's ways to throw it off. Okay. All right, identifying nutritional imbalances. We have to do a complete general survey, because again, when you first walk in the room, you can tell if somebody is overweight or underweight, right? Mm-hmm. Because if they're overweight, they're fluffy. Okay, there's more than the love. But if they're underweight, you're gonna see more bone definition. Okay, they might appear to be a little more scrawny or smaller in general. Okay, Alterations in vital signs, their blood pressure, if it's elevated, is typically related to FVE or overhydration. FVE stands for fluid volume excess. They have too much fluid in their system, okay? A low blood pressure usually is indicative of dehydration. And if they have an increased heart rate, typically that's a fluid volume deficit or dehydration as well, okay? We're gonna look at the blood glucose, serum albumin, creatinine, and hemoglobin. Those are all things that we're gonna look at to get an idea of nutrition, okay? Glucose is fairly obvious, blood sugar, okay? Albumin, it's protein. Best way for me to kind of help you to remember albumin is protein. What's the white part of the egg? Go back to biology. What's the white part of the egg?
Egg whites.
Well, yeah, egg white. But what's the technical term?
Oh.
Albumin.
Oh, I thought that was the yellow part.
Yeah. Okay. No, that's the yolk.
Yeah.
Okay. So, and what is contained in the egg whites? Protein. Okay. Creatinine, that is a byproduct from kidney filtration and the effectiveness of that. So that's going to tell us how well the body is filtering out toxins with urine, fluids, all that fun stuff. And then hemoglobin is going to give us an idea, not so much as far as filtering or anything, but iron level. Okay, going back to those red blood cells. If somebody's hemoglobin is low, okay, they might be anemic. They don't have enough red blood cells, so therefore their body's gonna have to work harder to transport oxygen. Okay. All right. Other lab values, you talked about blood glucose already and serum albumin. I will say there's prealbumin and albumin. Albumin is over like the last 3 weeks. It gives you a kind of an idea of what their overall nutrition intake status is over the last 3 weeks. Okay, kind of like an A1C. Have you guys ever heard of a hemoglobin A1C? That's, yeah, their blood sugar over the last 3 months. If that A1C is elevated, then their blood sugars have been elevated for the last 3 months. That's kind of what a albumin level is. But a pre-albumin is a little bit more finite, and then it's over the last couple of days because it fluctuates every day. Okay. So it's like if they've got a low serum albumin, but then your pre-albumin is elevated, they may have been hungry for a little while, but then they finally got something to eat, and then their protein's going to go up that day. Okay, the albumin level. We talked about creatinine. We talked about hemoglobin. So, creatinine, of course, is going to be a little bit different, along with hemoglobin amongst men and women. Okay, they're going to say something controversial yet, Brave, but yes, women are more superior. I already said that numerous times. But why would men have higher levels of creatinine and hemoglobin?
They don't have periods.
Pretty much. But what we typically do have more of is muscle mass. Typically. There's some ladies out there, I'm like, damn! Don't mess with her. Okay. All right. Managing the imbalances, we got to figure out what's causing the imbalance. Okay. If they don't have enough creatinine or too much, we got to figure out why. Typically, it means that they might have some kidney disease, okay, or they're not drinking enough fluids and it's causing kidney damage. All right. As far as undernutrition, well, why? Why aren't they eating enough? Do they have no access to food to get it every day? All right. If so, we need to put them in touch with ways for that to happen. We have so many public resources available, although I swear it's harder to get a hold of them. But food stamps is one, okay? There's no shame in eating it. You know, if you're just not able to make ends meet, you're not able to make ends meet, okay? My sister was 14 and became a mother. She couldn't get a job, she wasn't of legal age. So for the first 2 years, she was on WIC. And we got Kix and peanut butter and cheese and milk. Huh?
Now you get tortillas.
Now they even give you tortillas now? Oh, hell, I'm pregnant. I got a food baby. But yeah, so then because again she couldn't work, she got welfare because in California at that time, by giving birth, she was considered an emancipated woman. So technically my mom was supposed to charge her rent, but she didn't for obvious reasons. So yeah. All right, examples of overnutrition, again, overeating. How many of you guys will sit down in front of the TV and just plow through a bag of chips? Yeah, okay. It is complete mindless eating, all right? Why do we not like just take a handful, put them in a bowl, and go sit and watch TV that way?
But I bring it up.
See, that's the bad thing. It's a
Dirty
habit.
extra dishes.
It's a habit. Yes, it's extra dishes. But I would rather have extra dishes than another heart attack.
See, I'd rather have a heart attack than a
No. You really don't, because there you got no shame whatsoever, because everyone sees everything.
Ooh,
Because they take a nice big old catheter about the thickness of a number 2 pencil and go in your groin and go up into the heart to check the flow of it, and then if there's a blockage they'll put a stent in, which is a nice little cage that opens up the vessels and holds it open. Trust me, you don't want one. And I have 2 stents now, so yeah. All right. All right, managing imbalances, client family teaching. What are the vitamin and mineral supplements that they could have, okay? Are supplements fantastic?
No, fantastic.
Supplements are not regulated.
Yeah, they're not ready.
So you do not know for sure that what you are buying, you are getting. They are not regulated by the Food and Drug Administration, okay? Your medications are, but not the supplements, all right? So really, the best way for you to get the nutrients and things that you need is to intake them, eat them, okay, or drink them, however, okay? Another thing too, older people who are on a fixed income, okay? There are, especially when you guys get into your community health rotations in semester 7, I think, you guys go out into the public and do help with like home health and things like that. You will see people are, the elderly specifically in some cases, having to choose between food and their medications, okay? They don't have the money to even go to the dollar store to get food that's about to expire or anything like that. So one program we have here in Arizona is called Meals on Wheels, and basically there's a person that comes by once a day and delivers food. And obviously the person doesn't get a choice as far as what is in there, but it's free food. Okay, paid for through donations and food banks that have food that's expiring, so they need to get it out there. I forget, somewhere in the United States recently they made a law that grocery stores were not allowed to throw anything out. No, they had to donate it. So any food product that they had that was either just getting ready to expire or they were not able to sell, they couldn't throw the food out. So all the vegetables and fruits and all that fun stuff, they had to donate it to a food bank or a program like Meals on Wheels. I forget which state it was. Was it California? Okay. It makes sense, right? Instead of throwing out the food, well, all right, and we talked about that. There's other forms of Meals on Wheels. There's, what is it?
There's like a program, isn't it? Like they go to your house and they deliver your food. Like a
Yeah.
meal or regular food.
Yeah, there's, not Healthy Choice, what is it? Oh my gosh. Cause it's like Blue Apron is one of them, where they deliver, HelloFresh is one, that was actually pretty good. I will say. It's a little pricey. But their Blue Apron was way more, or Home Chef was another one. They give, everything's already portioned out, you just have to do the prep work, which was actually kind of fun, because I was like, oh, I'm gonna try this tonight. So, but there's another one for like severely ill patients that, you know, aren't over 60, so they don't qualify for Meals on Wheels, but they might be suffering from HIV or AIDS infection. I think it's called Angel, what is it? Angel Wings, I think maybe. I'd have to look to double check. But people go and deliver meals to those people so that they have food in the house. Okay. Some things as far as imbalances, support the special needs that the patient has, as far as nutritional needs. Clients who are NPO, meaning
By mouth.
nothing by mouth. Okay, they're not allowed to eat or drink anything, even hard candy. Okay, I've had doctors cancel surgery because the patient had a Jolly Rancher or a cough drop in their mouth. Okay, we're not being mean, because when we anesthetize people, everything relaxes, including those sphincters. So if they've got food in their stomach, where's that gonna go? Probably gonna go in their lungs, because that protective sphincter right here is now open. Okay, it's for their safety, not to be mean. All right. Assisting clients with meals. Now, how many of you guys had clinicals this week for the first time? Just Miami, right? Right? So, did they have you guys feed patients
Yes.
at all?
I did.
What was it like?
It was okay.
Well, it was okay. Well, did you talk to them or anything? Okay.
Yeah, they were really happy to have us help them.
Yes.
Because usually, if it's one tech and they've got 5 or 6
Yes.
people, they're just like, here, take a bite. Here,
Yes.
take a bite. Here, take a bite. I'm back. Here, take a bite. Here, take a bite. Here, take a bite. Seriously.
Yeah.
Pretty much. But I mean, I remember as a feeder, I would sometimes have 6 patients that I was trying to feed all at once. Okay, so the patients unfortunately suffer at that point.
Yeah.
But that's one thing that, as a student, rock on. Okay, but did they tell you to push any specific type of part of the meal with the patient? No.
No.
Oh. Okay. You want to push the protein, big time, push the protein. Now, when it comes to a lot of elderly though, they might not touch anything but the sweet stuff. Because sweet is one of the last senses of taste that goes. I have seen patients take entire packs of sugar or sweet and low and just cover their plate with it so that they could taste the food. Okay? So, yes sir?
That thing, that you just mentioned.
Sense of
like,
taste?
Yeah, taste, right.
Saccharin?
Is that in all people or ill people?
Typically in the elderly. So, yeah, well, I would just say elderly in general, whether they've got a chronic health disorder or not, because my mom's doing the same thing. She is only eating all the sweet stuff, and she will go to the dollar store and get those stupid nutty butter. All right. The other part of assisting clients with meals is to make sure that they have the adaptive utensils that they are supposed to have, okay? So that they can feed themselves if necessary. We've talked about those wider gripped utensils for the fork and the knife and the spoon or whatnot. Again, that allows the person to be able to grab it. If they've got arthritis, they can't grip those smaller utensils, or maybe they need thinner ones because regular utensils are too heavy for them. Okay, so we need to make sure that that's going appropriately. Delegating feeding. Who can feed a patient?
Personnel.
Thank you, personnel. Can housekeeping?
No.
Can anybody off the street?
No.
No, preferably a NA, a nursing assistant. Med techs are not supposed to. They might a little bit with giving the medications, put their medications in like applesauce or pudding to make it easier for the patient to take it. But in general, they're not supposed to feed. It has to be either an RN, an LPN, or an NA. Okay. Home care, refer to agency for help obtaining food. Again, we've got Meals on Wheels, we've got food stamps if necessary. I remember when food stamps, they would give you a packet of like tickets, and they were worth like $1, $5, $10, whatever, and then they would. And now it's EBT.
Yep.
I was like, what? Electronic benefits transfer.
Now they get.
Now they just recharge the card every month. All right, modified diets. You do need to be familiar with these. Okay, we have a regular diet. You might see it referred to as a house diet. That means the person can eat whatever it is that they want. Okay, no restrictions. NPO we've already talked about. Clear liquid, those are the liquids that you can see through. Okay, Jell-O is on a clear liquid diet, but again, it does not count as a liquid. Because at room temperature, it is still solid at room temperature. Okay. Ice cream, believe it or not, will count as a liquid because at room temperature, it is liquid.
So Jell-O's on a clear liquid diet, but doesn't count as a liquid.
Liquid, correct. Okay. But typically, clear liquids are after surgery. Patients who have a GI disorder, we want to give the stomach a chance to rest, actually the whole GI system. Okay. Full liquid is basically going from a clear liquid, we're transitioning to a soft diet just to get, kind of get back in the groove of things. We have a high fiber diet, which would be, whole grains, raw or dried fruit. Be careful with the dried fruit because that can cause diarrhea. Okay. Blenderized or a pureed diet. For some, it can be related to, if they've had a broken jaw, they've had to wire the mouth shut for the jaw to heal. But in our population with the elderly, it's typically because they have swallowing difficulties, okay, or chewing difficulties. Then we have, another main one is a mechanical soft. So everybody here has had a loose meat sandwich, I'm sure, like a sloppy Joe, okay, or scrambled eggs. Those are mechanical soft things. They don't require necessarily full use of biting through it to chew it up. You can take eggs and go and chew with their tongue, right? And mush it up. Oatmeal is one. Cream of wheat. Not my favorite, but it is one of them. Huh? Oh, okay. Yes, Yvette.
I worked at a steakhouse for like 4 years, and our clientele, because I live in Gilbert, was elderly. And me and my manager had to do the Heimlich maneuver on.
Can't call it that anymore.
I can't.
No.
That's illegal.
Oh,
The
because,
family,
like, they're
the
suing
family
or
is
something?
wants it trademarked, so now we're not allowed to call it the Heimlich maneuver. It's an artificial cough or assisted cough. But go ahead.
I had to do an assisted cough, and my manager as well, almost every day.
Mhm.
People, like elderly, would come in and they would choke on their steak, no matter how small we cut it for them. And yeah, you would just at least once a day. One time it was 3 times.
Oh my goodness.
My manager
Idiot.
would like sprint across the restaurant, or another server would like yell, like me and him would just. It was so.
And has anybody here, other than Savannah, obviously, tried giving the Heimlich maneuver to somebody?
Artificial coughs.
Artificial cough? Yes, thank you. Yeah, it's not. It takes a lot. You think it'd be easy, but it's not.
It really is.
No. All right, and then we have the liquid consistencies. So we have thin liquid, which is what all of you guys are probably drinking, okay? Then we have nectar, which goes into honey, and then spoon or pudding thick. Fluids, yes, pudding thick fluids. Ugh. Okay, now, when I was where your guys are sitting, I always was like, well, why are we giving thickened liquids to people who have swallowing difficulty? You would think that's going to cause them to cough more, right? So does anybody know the answer to that? Well, yeah, obviously, so they
But
don't
it's like-
aspirate, but how does that work within here with the swallowing function?
Isn't that slippery?
It's not as what?
Slippery, like it doesn't go.
It takes longer for the thickened liquid to go down, which gives the epiglottis more time to cover the trachea and the windpipe. That's how it works. Can they still choke on these? Yes. Okay. If somebody is almost, I would say pretty much to this point where their liquids have to be pudding thick, they should probably have a G-tube placed. Because that's, imagine trying to take in pudding thick water. Yeah, no thanks, I'll pass. All right, we got some practice questions, and then you're free. Okay. So the nurse is teaching a client who has iron deficiency anemia about foods she should include in the diet. The nurse determines that the client understands the dietary modifications if which of the items are selected from the menu. So okay, we have iron deficiency anemia. What does that tell you the patient needs more of?
Iron.
Iron. Okay. Huh?
Is it greens and veggies? Like anything?
Greens? Yeah, that's one. So leafy greens, so like spinach.
Yeah.
Where did we spinach? Okay, what else? What are some, other than leafy greens, what are some other sources of iron? Red meat, lentils. Anyone else?
Liver.
Liver.
Yeah, liver's good.
No, I don't like liver. All right, so up here we've got A, nuts and milk, B, coffee and tea, C, cooked rolled oats and fish, or D, oranges and dark green leafy vegetables. D. All right. Nurse is planning to teach a client with malabsorption syndrome about the necessity of a low-fat diet. The nurse develops a list of high-fat foods to avoid and should include which food items on the list? Probably more than we care to list, huh? But what are some examples of high-fat foods? Butter, cheese, although I love cheese. Say what? Certain cuts of meat, yes. So sausage, even breakfast sausage, those are more of the offshoots or offal meat that they use that they grind up. Okay, so those typically have higher fat content. There we go, than usual. Okay, bacon. Okay. Potatoes, those are high in starch. Yeah, those are bad carbs for you. Okay, so which of these, because it's to select all that apply, your favorite would be something that we would probably want to avoid?
Broiled haddock?
Hadcock, it's a fish.
Avoid.
Oh. I have a question. If one of these were to come up on the test and we were to ask like what broiled
Haddock,
is,
I would tell you.
Oh, okay, cool.
Yeah. Because, I mean, we obviously don't want to put broiled fish because that's too obvious, you know, but if you were to ask, well, what the hell's haddock? Okay, or what's linguiça? Okay, I would tell you what that was.
Okay.
You know what I mean? Because you might pick this thinking, oh, well, that's got to be low fat. Well, yeah, it is low fat, but we're looking for what? High fat foods to avoid. You know what I mean? So, all right. A post-operative client has been placed on a clear liquid diet. The nurse should provide the client with which items that are allowed to be consumed on this diet. So what are some that I gave you? Jello, broth, apple juice, grape juice? It depends on your facility, I will say that, okay? Don't forget, what else is a clear liquid that you should be pushing your patient to have?
Water!
Okay, so we got broth, coffee, gelatin, pudding, vegetable juice, or pureed vegetables.
Gelatin, vegetable juice.
Broth, gelatin.
So should we put that on? No. So we got broth, coffee, gelatin. Those the three? Or four?
Coffee's not clear.
Not clear.
Coffee technically is a clear liquid as long as there's no cream in it. When they're like a latte or a cappuccino would not be considered clear, but just black coffee, that'll work. All right, the client is recovering from abdominal surgery and has a large abdominal wound. I spared you the picture this time. The nurse should encourage the client to eat which food item that is naturally high in vitamin C to promote wound healing. What are some foods high in vitamin C? Oranges. What else?
Leafy greens.
Let's see what we got listed here.
Well, oranges. Answer.
Only orange.
Broccoli actually has quite a bit of vitamin C in it too. It doesn't taste as good as an orange, but yeah. A client who is recovering from surgery has been advanced from a clear liquid diet to a full liquid diet. The client is looking forward to the diet change because he has been bored with the clear liquid diet. The nurse should offer which full liquid item to the client? Oh, that went too fast. Dang. Well, custard, I guess.
Custard.
I'm just gonna throw a bone out there for that one. All right. So the two main ones that you guys eventually by the end of the semester you will need to know all four of these. Okay. The main two that I really want you to memorize is the potassium and the sodium. Okay. Potassium, a expected range for your exams in school is anywhere between 3.5 to 5 milliequivalents per liter. Okay. For sodium, it's I was always told it was 135 to 145, which is easier to remember, but for whatever reason, ATI says 136 to 145 milliequivalents per liter. All right.
So,
Later on, you will need to know magnesium is 1.3 to 2.1 milliequivalents per liter, and calcium is 9 to 10.5 milligrams per deciliter. Okay.